The coronary circulation consists of coronary arteries and veins. The right and left coronary arteries encircle the myocardium like a crown or corona. The main coronary arteries lie on the outer epicardial surface of the heart. They branch into progressively smaller vessels, eventually becoming arterial and then capillaries. Thus, the epicardium has a rich blood supply to draw from. Branches of the main coronary arteries penetrate into the heart's muscle mass and supply the subendocardium with blood. The diameter of these feeder branches, also known as collateral circulation, is much narrower. The right and left coronary arteries are the very first branches off the base of the aorta. The openings of these vessels lie just beyond the cusps of the aortic valve. The three major coronary arteries include the left anterior descending artery, the circumflex artery, and the right coronary artery. A person is said to have coronary artery disease if there is more than 50% diameter narrowing or stenosis in one or more of these vessels. Let's now take a look at the right coronary artery. The right coronary artery originates from the right side of the aorta. It travels along the groove between the right atrium and the right ventricle. A branch of the right coronary artery supplies the following structures: the right atrium, the right ventricle, the inferior surface of the left ventricle in about 85% of individuals, and the posterior surface of the left ventricle, and the sinoatrial node, and the AV bundle. The left coronary artery originates from the left side of the aorta. The first segment of the left coronary artery is called the left main coronary artery. It is about the width of a sawdust straw and less than an inch long. Blockage of the left main coronary artery has been referred to as the widow maker because of its association with sudden cardiac arrest when it is blocked or has a pathology. The left anterior descending coronary artery can be seen on the outer or the epicardial surface on the front of the heart. It travels along the groove that lies between the right and left ventricles. In most patients, the left anterior descending travels around the apex of the left ventricle and ends along the left ventricle's inferior surface. The left anterior descending coronary artery supplies blood to the anterior surface of the left ventricle and part of the lateral surface of the left ventricle, as well as the anterior 2/3 of the interventricular septum. The circumflex coronary artery circles around the left side of the heart in a groove on the back of the heart that separates the left atrium from the left ventricle, called the coronary sulcus. The circumflex supplies blood to the left atrium, to part of the lateral surface of the left ventricle, the inferior surface of the left ventricle, the posterior surface of the left ventricle, the SA node, and the AV bundle. Now, when we talk about coronary artery dominance, this is what we mean. In about 50% of people, the right coronary artery forms the posterior descending artery. In about 20% of people, the circumflex artery forms the posterior descending artery. The coronary artery, therefore, that forms the posterior descending artery is considered the dominant coronary artery. That concludes our discussion on coronary circulation and blood supply.